beautiful thing about the robot is that it has totally changed the dynamic of what we're doing surgically and GYN. It has absolutely changed the landscape. People that had previous surgeries and complications, or just a lot of surgeries and scarring that used to traditionally have to be open with larger incisions, the robot just allows us to do it minimally invasively. And people are leaving the next day. This is not a 3 to 4 to 5 day hospital stay with complications or other issues. They're leaving the next day. And so it has really changed dynamic in the environment when people need to go back to work, get back to their families, and have literally needed surgeries for a long time and are just reluctant and can't because it was going to be a major surgery. They are really benefiting from this. You're going from incisions that are larger with a longer downtime to little small incisions the size of a dime, and then walking out, sometimes even without an escort from the hospital the next day, is the biggest benefit across the board. Everything we see is magnified. It's 3D magnified. So I have human eyes, but this is magnified like we're shrunk inside the abdomen. But the most important part about it is anything I can do with my hands or my arms, I can replicate with the instrumentation inside the patient's abdomen or belly. That's a lot different than traditional surgery with either your hands in there or laparoscopically, where instruments can't give you that dexterity or that ability to manipulate. So we're able to get in places that we weren't before much easier. Certainly we have other types of surgeries that we don't deploy the robot for, and that's just right medicine to do that for those patients. But in these complicated patients are coming in, they're almost expecting at this point. And I think that's great if the community is grabbing hold of this technology. So I think the fear of it has gone by the wayside since we've brought the skill set to it now with the larger numbers of procedures we've done. There's a confidence interval on both sides, and that's a good thing.